Hi beautiful people, welcome back to another video. I am so glad to see you again and thank you for clicking on this video to watch. If today is your first time seeing me here, my name is Christina. I am an LPN and a part-time breeder. On here I do videos in nursing, hair and beauty, lifestyle, and I touch base on anything I lay my hands on. So you are welcome to be part of this space by subscribing. Please guys, subscribe to be part of my family. And I love you so much and thank you for clicking on this video once again. All right, so in this video I will be giving you few or maybe probably everything that you need to know on passing medication, like the little bit of tips that you need to adopt when you're passing medication at work. Okay, so I have everything on my laptop here, so I will be going through one at a time. If I miss anything and you know about it, you know it will help someone, just drop it in the comment section. All right, so let's get going. So the very first thing I will talk about is to be on time. Guys, you don't know what like if you are late to work, it ruins everything. The pressure on you tend to rush through your work. So please be on time, at least 15 minutes before your actual time, so you can take time to breathe in, you breathe out, like to relax. Most of the times, especially myself, like I get to work maybe 20 minutes earlier. Before, when I started work, it used to be so like too much. I'll be at work 30 minutes earlier and I'll just be sitting in my car listening to some music, you know, just refreshing your soul. Because the moment you get in that building, guys, the life of precious ones are in your hands and you just cannot afford to make a mess, or you just cannot afford to cause any harm, you know. So you need to like refresh yourself, you need to let go everything, because the moment you hit that door, that quarrel you had with your husband has to stay, that quarrel you had with your wife or kids, or everything that is bothering you has to stay. Because at the end of your 8-hour shift, 12-hour shift, 4 hours, whatever it is, you'll be back to your house. So please be on time. Try as much as you can to be on time at work, so you can get all that time to, you know, relax your body, relax your mind, and be ready. Okay? All right, so the next thing is pray. Guys, you cannot do without this. You cannot, because trust me, like the things that go on in this healthcare facilities is not easy. You need God to hold you up to be able to go through it. So you have to pray. Say a word of prayer in your car whilst you relax and you hit that door and start. And also the next thing is to get your report and you count the narcotics with the previous nurse. So after you get your report, and also with the report, please make sure you get a detailed report, because I have had an experience with a nurse who will say everyone is fine, nothing happened. Something happened. So please tell me, even if a family member visited, like something, just tell me, you know, so that I will know what I'm getting myself into during my shift. So you get a detailed report and you also count the narcotics with the nurse. Also, sometimes when you get familiar with your colleagues, you tend not to count the narcotics, but you never know, things do happen. So please try as much as you can to count the narcotics so that you cover your back, you know, be on the safer side. All right. Okay, the next point is to restock your cats. Guys, in my facility, like we have a med room where you go, you pack everything. You do not want to be running back and forth, because the moment you leave the cart, you have to close the cart, close the like all those stress. You want to prevent and save yourself from all those stress. So make sure you pack everything you will need through your med pass: the pudding, the water, the gloves, the paper towel, paper tissues, the spoons, the cup, like everything you will need, so you will avoid running back and forth to get an item. You know, anything can happen. So please prevent all that. The next step is, after you have restocked and everything, guys, again, take your time. Take your time. Guys, I don't want to stress this enough. Take your time. Because just imagine, like, someone's life is in your hand. Take all the time you need in the world. That is why initially I said you have to be on time early, because when you are in a rush, when you are late, guys, already your mind is so messed up on the road before you even hit work. So it will be stressful already. Please take your time. Take your time. Taking a deep breath in and a deep breath out, and take all the time you need, okay? The next thing is also you check your vitals. This is very important, because if you have patients who take blood pressure medications and also ACI checks like blood sugar, you check all those things so that you would know the medications to give them and the ones not to give them. Especially with diabetic patients, you have to monitor their blood sugar and know the insulins to give them as soon as possible before you even start anything else. So you do your vital signs before you hit, you know, the main thing. The next step is to ask about PRN medication. So PRN medications is a medication that are given as needed by the patients if they ask for it, or if you think they need it because of the vital signs that you checked and all that. So based on the vital signs, you will know the ones to give them PRN medications before you even go ahead and do the main med pass. Also, another tip is to do one patient at a time. I have worked, when I was an STNA, I used to work with this nurse. Oh my God. She is always in a rush, doing a lot of patients at a time, and she's missing. So, like, do not be clumsy, guys. Do one patient at a time. You can make the least error that could have been prevented. So please do one patient at a time, okay? The next tip is write everything down. Usually when you're going on, it depends on the facility you work in. In my facility, we still use the MAR. Other facilities use softwares that you can take, you know, your small iPad on the CAT, or you know, something that you can easily chat or do something while she have the cats with you. But with me, for instance, my facility, we still use the MAR. So I am fond of using like a sticky note or a small notepad just to know what is going on whilst I'm in the patient's room. My patients are not verbally, you know, like that. But if you tend to work, I have worked in an assisted living facility before. So in this situation, when they tell you, oh, I feel a pain here, I feel like everything they tell you, make sure you write it on that sticky note. Because when you get on the computer to chat, then you will know all the details that you gathered from that patient. If they tell you and you don't write it anywhere, guys, trust me, if you have 20 patients, 25, 30 patients, you can easily forget. So please take a sticky note and make sure whatever they tell you, you put it on that sticky note, and that will go in the nursing notes or wherever it needs to go, so that it will be taken care of, okay? The next tip is also to count your narcotics before the next shift nurse comes in to take up the shift. This will prevent any errors that you have make. You know how to correct them, and if it cannot be corrected with you alone, then you know what to report to the next nurse when he or she comes in. So you have to make sure that all these things are cleared before the next shift nurse report. The next I think that is the last but one. You have to clean and restock. Most nurses make your life easy by restocking for you. Some do not do it. So just make sure your cart is clean, everything is charted. Guys, remember, if it's not charted, it is not done. So you make sure you chart everything. You clean your cart, you wash what you have to wash, you dispose what you have to dispose, and make the space clean for the next shift nurse, and also restock items that you have used that you think and know that it needs to be restocked, okay, so that you can work in a peaceful environment. And the last thing, guys, just as you started with a prayer, and with a prayer for a safe shift, because there is nothing like going through a 12-hour shift or 8-hour shift or whatever shift that is, and knowing that there was no error, there was no casualties, there was no emergencies, like there was nothing like that, and you going back home with a sound mind. There's nothing like that. So just as you started with a prayer, you end with a prayer and you thank God, and au revoir, you go home, okay? So that brings me to the end of the tips of passing medication. If I missed something out and you have an idea, please drop it in the comment section and let's all learn together so we will excel in this our healthcare journey. We are doing this together, remember, okay? All right, guys, so this brings me to the end of this video. If you enjoyed this video, please do not forget to give me a thumbs up. Also share this video and share your thoughts in the comment section, and please subscribe, okay? Subscribe, okay? All right, please subscribe for me and you'll see more of me. Thank you so much. God bless you. Always remember, you are unique in your own special way. There is no one like you. You are unique, okay? So appreciate yourself, love yourself more, and do you. I will see you in the next video, guys. Love you. Bye.